Hello, my name is Dr. Dewan S. Raja. Today I will discuss about brain abscess. A brain abscess is a collection of pus within the brain tissue due to an infection. Abscess is a localized collection of pus. That infection may be bacterial, it may be fungal, it may be protozoal, but mostly it is bacterial. It typically arises when bacteria, fungi, or parasite invades the brain, leading to localized inflammation and tissue destruction. Streptococcal, Streptococci and Staphylococci are the most common offending organisms identified in non-immunosuppressed patients. But in case of immunosuppressed patient, it may be fungus, it may be a protozoa parasite like toxoplasmosis. Morphology of the brain abscess. Abscesses are discrete lesion with central liquefactive necrosis. At outer margin of the necrotic tissue, there is exuberant granulation tissue with neovascularization. That means new blood vessel formation, as because it is an inflammatory condition, will get the granulation tissue. The newly formed vessels are abnormally permeable, accounting for marked vasogenic edema in the adjacent brain tissue. So, brain abscess is surrounded by edematous brain tissue because of excessive permeability of the new blood vessel formation. It is well established in well established lesions. A collagenous capsule is produced by fibroblasts derived from the wall of the blood vessels, particularly from the outer wall of the blood vessel, from the tunica adventitia. Outside the fibrous capsule is a zone of reactive gliosis containing numerous astrocyte. This type of astrocyte is a type of neuroglia where the nucleus is eccentric. Okay, so we got that. Now, what are the causes of brain abscess? There are many causes. It may be due to infection from nearby area like middle ear infection. We call it otitis media. Sinus infection, sinusitis. It may be maxillary sinus involvement, maybe ethmoidal sinus involvement, maybe even frontal sinus involvement. Dental infection spread through bloodstream, lung infection, that is pneumonia and bronchiectasis, heart infection, that is infective endocarditis, and other systemic infections. Causes of brain abscess continued. We're continuing on brain abscess causes, trauma or surgery, penetrating head injury, neurosurgical procedure, immunosuppression, people with HIV, AIDS, organ transplantation, cancer or chemotherapy, long-term steroid use. So we got many causes, infection, particularly from the surrounding area of the head and neck, maybe due to trauma or surgery, maybe due to immunosuppression. Okay, so if we go from the very beginning, we must look at the abscess. What is the image? Image is here. Here is the brain abscess. Here. It may be in other places, but maybe frontal lobe and junction between the gray matter, white matter is a common site of brain abscess. We got the causes of brain abscess. Then we go to the symptoms of brain abscess. Symptoms depends on the abscess size, location, and associated swelling, that is edema, but can include neurological deficits, weakness, difficulty speaking. It may involve the speech area, maybe the motor speech area of Broca, most commonly the Wernicke speech area for comprehension. So weakness, difficulty speaking, or changes in vision if it involves the visual pathway to the occipital lobe. Headache, often severe and persistent, that may be due to increased intracranial pressure, fever and chills due to inflammation, nausea, vomiting, again due to inflammation and increased intracranial pressure. Seizure may be due to increased intracranial pressure, altered mental status, confusion, drowsiness, or coma. And certainly, a lot of these symptoms are linked to the increased intracranial pressure due to swelling. Our cranial cavity is a closed space. It is occupied by brain. There is no empty space. So if there is any abscess, swelling, edema, certainly there will be increased intracranial pressure. Diagnosis, imaging studies, CT scan, initial imaging to detect a ring enhancing lesion. MRI provides more detailed images. Blood test, elevated white blood cell, as because this is an inflammation. Increased inflammatory marker like CRP and ESR, erythrocyte sedimentation rate. Microbiological studies, aspiration or biopsy of the abscess to identify the causative organism. This can be done by fine needle aspiration. Lumbar puncture to assess the cerebrospinal fluid, but it is rarely done due to risk of brain herniation. This happens because there is increased intracranial pressure. The brain may be lacerated or the concavity of the tentorium cerebelli. Okay, this is the brain abscess, ring enhancing mass. We are seeing some edema. Surrounding tissue has edema because of permeability of the newly formed blood vessels. Treatment of brain abscess, antibiotic or antifungal therapy. If there is fungus is the cause in usually an immunocompromised patient, then antifungal therapy. Usually it is treated with antibiotic and usually given intravenous. Broad spectrum antibiotic often tailored after identifying the pathogen. Duration, it should be long-standing duration because antibiotic may not reach to the area of brain abscess. Typically 4 to 8 weeks. Surgical drainage that is required when antibiotic does not work. Performed in the abscess is large, causing significant symptom and not responding to antibiotics. Methods, aspiration or excision. Supportive care, anticonvulsant for seizure, corticosteroid to reduce brain swelling. Management of underlying condition, treat the source of infection to prevent recurrence. Complications of brain abscess, persistent neurological deficits, because brain substance is already necrosed through liquefaction necrosis damaged, so there may be persistent neurological deficits. Seizure, that may be the focal point of epilepsy. Recurrence of abscess, in case of particularly in immunocompromised patient or untreated patient. Increased intracranial pressure, brain herniation, a life-threatening emergency. The increased intracranial pressure can lead to fatal herniation. Other complications include abscess rupture. If it is close to a ventricle, then it will spill throughout the ventricular system, including the central canal of spinal cord. Or if it enter the subarachnoid space on the outer aspect, that may also cause spread to other part of the brain. Okay, there may be chance of ventriculitis, rupture into the ventricle, or meningitis and venous sinus. We have sinuses like that of transverse sinus, suprasciatal sinus, straight sinus. So that we may have venous sinus thrombosis. Prognosis. With early detection and appropriate treatment, prognosis is favorable for many patients. Though recovery may take weeks to months, delayed treatment or severe infection can lead to significant morbidity or mortality. If you suspect a brain abscess, as a physician, seek immediate medical attention as it requires urgent intervention. With surgery and antibiotic treatment, the otherwise high mortality rate can be reduced to less than 10%. And that's all about the brain abscess. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe. Have a nice, wonderful, and blessed day. Bye now.